smile.
This is my audience today. I'm Diana Thomas. This is Communications 101, Speech 3, informative, titled Lasik Surgery. Ready? 1 year ago, my mother had stroke, and that left her with poor vision. She's a nail technician, so her vision was very important to her job. She took some time off to see if her vision would recover, and it was then that I suggested to her Lasik. I saw it on TV on a commercial, and so I thought maybe it would help. I went with her to the consultation, and 1 week later she had Lasik surgery performed on both eyes. Amazingly, she fully recovered with 20/20 vision. I was jealous of her because I've worn glasses since second grade at a very young age, and I wanted to try it. So I went in for a consultation, and unfortunately they told me I needed to wait a year due to some complications in my eye. In the meantime, I wanted to learn more about this procedure that has caused millions of patients of the surgery to have experienced significant vision improvement, including my mom. Today, I will share with you part of what I've learned, explaining how Lasik came about, how it works, and where to go to get this procedure done. Let's begin by looking at the history of Lasik. Lasik is still a pretty new procedure. It's been around for maybe 23 years, but they've researched it for a very long time now. Dr. Tomato Sato is the grandfather of Lasik. He started experimenting with deep eye incisions that proved to be disastrous. The patients experienced blindness and just white blur. They couldn't see. So in 1960, Dr. Forjarvo, bear with me in these names because I can't pronounce them very well, improved the process, and he better understood how the system of eye correction worked. It was finally in June 1987 that Dr. McDonald performed the first successful surgery. Since then, modern technology has improved to make laser surgery more effective and easier to perform. On LasikSurgery.com, a resource center for finding the best Lasik eye surgery information, estimates that about 1 million people have done the surgery in just the year 2000. Now let's look at how Lasik actually works. During the Lasik procedure, a skillfully trained eye surgeon cuts a flap with a what they call it, a microkeratome blade. You just cut it, put the flap back, pull it back, and actually uses the laser on your cornea to reshape the eye. Then he just puts the flap back down on the eye, and it recovers quickly. I actually have a video clip here I want you to focus on to better help you understand how this procedure is done. As you can see, the procedure itself only lasts about 10 minutes and patients don't experience any pain. But where can you get this surgery done, you ask? Well, let me help you with that. Lasik in Indiana is available in many cities. These centers will give you information and proper testing and consultation for you. There are websites you can find and it'll help you find a center near to you. OnMedicine.com is a nationally recognized doctor-produced website that offers lots of information explaining where you can find a local surgeon and a checklist to help you select one. They also share with you how much it may cost, and it can average around $1,000 per eye. It might sound costly to you, but if you ask my mother, she would tell you it was all worth it. Today, we have learned about the history of LASIK, where to get this LASIK procedure done, and how LASIK works. I hope you know more about this procedure and the benefits that it can provide you. After many years of being dependent of glasses and contacts, I am ready to experience freedom just like my mom did. Thank you.